Stem cell therapy represents one of the most promising frontiers in regenerative medicine, harnessing cells' unique ability to differentiate and promote tissue repair. These treatments have shown remarkable effects in blood disorders, certain cancers, and degenerative diseases, with ongoing research exploring spinal cord injuries, heart disease, diabetes, and neurodegenerative conditions. The most established use remains hematopoietic stem cell transplantation for leukemia and lymphoma, which has saved countless lives over decades. The benefits are substantial, repairing damaged tissues, reducing transplant needs, and slowing disease progression. For multiple sclerosis patients, early stem cell intervention has improved quality of life significantly. The regenerative potential extends to orthopedic applications for cartilage and bone repair, while accelerating our understanding of disease mechanisms and drug development. Real patient experiences illustrate this transformative power. Kristen Comella, suffering from debilitating rheumatoid arthritis that prevented her from working or caring for her children, underwent adipose-derived stem cell treatment and regained mobility and quality of life. Sickle cell disease patients have achieved functional cures through transplantation, transitioning from frequent hospitalizations to normal, pain-free lives. These successes underscore the importance of pursuing legitimate treatments rather than unregulated therapies. Global adoption varies considerably. The United States, Japan, South Korea, and the European Union have developed robust regulatory pathways with strict oversight. Japan's conditional approval system has been particularly progressive in accelerating patient access. China, India, and Southeast Asian nations have become major research hubs, though standards vary. Australia, Israel, and Singapore have emerged as innovation leaders. Challenges remain: high costs, limited insurance coverage, unregulated clinics offering unproven treatments, and ongoing ethical debates. The future holds extraordinary promise. Scientists are developing methods to generate functional organs for transplantation, addressing donor shortages. Gene-edited stem cells using CRISPR could correct genetic defects before transplantation. Clinical trials are investigating neurodegenerative disease treatments, potentially replacing damaged motor neurons in ALS patients. Three-dimensional bioprinting combined with stem cells may soon create complex tissues and miniature organs for drug testing. Induced pluripotent stem cells, adult cells reprogrammed to behave like embryonic ones, enable personalized medicine without ethical concerns. Cancer immunotherapy using modified stem cells could revolutionize malignancy treatment. Embryonic stem cell research remains deeply contentious. Supporters argue that saving lives and alleviating suffering outweighs concerns about embryos otherwise discarded from fertility clinics. They emphasize early-stage embryos lack consciousness, that curing existing people should take priority, and that strict ethical guidelines ensure responsible research. They note embryonic research has actually accelerated advances in adult and induced pluripotent stem cells. Opponents contend human embryos possess inherent dignity, requiring protection regardless of intended fate. They argue destroying embryos crosses a fundamental moral line, treating human life as instrumental. Many religious and philosophical traditions hold life begins at conception, making this research equivalent to taking human life. Critics worry about exploiting women for egg donation and potential slippery slopes toward troubling applications like cloning. However, many opponents support adult and induced pluripotent stem cell research, which avoids embryo destruction while offering significant therapeutic potential. This ongoing dialogue continues shaping research policies and funding globally, reflecting deeply held values about human life and scientific inquiry's limits.